So I chose to do my presentation on the Epstein-Barr virus. My name is Elizabeth Griffin. What is Epstein-Barr? Well, that is the name of the virus. It's also called the human herpes virus 4 or HHV4, and it is the causative agent of infectious mononucleosis, or what we more commonly know as mono. So physical characteristics, this is an image of the virus. As you can see, it's spherical. It has a lipid envelope. It's 100 to 220 nanometers in diameter. It has a double-stranded DNA. It also has a nucleocapsid. And on the edges, the little green structures are the glycoproteins used to infect cells, and they are the glycoprotein 350 and glycoprotein 42, which attach to CD21 and MHC2 on the receptor cells. Signs, symptoms, and characteristics. People often get a fever. They'll get fatigue, maybe a sore throat, nausea, cervical lymph, general lymph, swollen lymph nodes, and then swollen spleen. That's what this word is here. So an interesting fact is that most of the world is actually infected during childhood. It's just not yet detected as anything other than a cold until that person reaches adolescence or adulthood. And it's latently stored in the oral epithelium and B cells. It can actually insert its DNA into the host by inserting itself into the host nucleus. And I'll go over more of this in more detail in its reproduction cycle. So the viruses actually shed an oral secretion, and this peaks within the first 6 months. And then as the immune system weakens, the viral load and oral secretions will increase. Transmission, it's contracted orally through oral epithelium because the mouth is the portal of entry for this virus. And this is also why it's commonly known as the kissing disease. B cells in the nasopharynx of infected humans serve as a reservoir, and it's more common for immunocompromised people to show symptoms of this virus, and actually up to 95% of the population is infected by the age of 40. So reproduction, right here is a slide that tells you the whole cycle. I'm going to move on to an image of this and go into more detail and explain everything that's here on this slide. So on the left-hand side, you can see the virus coming into the cell, and the green structure there is the CD21, and so glycoprotein 350 will bind to that. And on the right-hand side, the red structure is MHC2, and that is what GP42 binds to. And these allow the virus to fuse with the cell membrane and enter the cell membrane. And then as you can see further down in the cycle, it actually enters into the nucleus. And then one of two things will happen here. If it goes into the lysogenic cycle, this is when the DNA is spliced with the B cell DNA. And you can see it comes a part of the DNA. And so when it replicates, that DNA stays in there, and so it's constantly in the DNA of these new cells that are created, and that is when it's in its latent cycle. Now if you go back to the center and you can see where the lytic cycle starts, this is when a person is actually contagious. And in this cycle, the virus enters the nucleus and the virus replicates itself. And then after it replicates, the cell lyses and more viruses are released to start the cycle all over again. And so that's where you have the two phases of the contagious phase and the latent phase. So in order to diagnose it, we often see swollen lymph nodes and enlarged spleen during a physical exam. But a lot of times they just pay attention to the symptoms that a patient is experiencing. And if they're having difficulty with this, then they can do a serological test. So when they test with titers. And if you're less than 4 years old, the IgM is a lot lower and it is a lot harder to detect. So we normally only detect for this if they're greater than 4 years old, and that is the most common that they will test for when they're testing for mono. And it peaks just after infection, and it's much greater for subjects over 4, like I just discussed. And then up top you can see the IgG titer, which comes on later, but it remains constant and is the main compensatory mechanism to keep the virus in check. And then on this slide you can see the early antigen, which peaks later as the viral load peaks. And then the purple over there on the right hand side, you can see the nuclear antigen, which increases over a long-term duration. But like I mentioned, the primary one they will test for is the IgM. And treatment, so there's actually no vaccine for mono, and there's not really a specific treatment. The best thing is to just take care of yourself. So get lots of fluids, bed rest, over-the-counter pain or fever medications to alleviate the symptoms, and just kind of monitor yourself and make sure that you're healthy. It's actually a low priority for the CDC because it doesn't typically result in fatality. Is very extremely rare. So it's there's no treatments for it. And so prevention, they actually recommended no kissing. Also using care when handling toys that children or infants have chewed on or salivated on. And also to avoid sharing personal items such as toothbrushes and chapstick. And to avoid sharing drinks, kind of just generally what you do to avoid any illness. But those are the primary things to look out for. And that is all. Thank you very much.